So what has happened is the Chhattisgarh High Court recently dismissed a petition concerning eligibility for the post of clinical psychologist. The petitioners relied on the Rehabilitation Council of India Act, that is RCI, and argued that only those recognized under that statutory framework should be eligible. Now, the court treated recruitment criteria as a policy matter of the state and did not interfere. Courts rarely rewrite eligibility rules unless there is a clear illegality. But the legal outcome is not the end of the discussion, because beneath this ruling lies a much larger discomfort within the profession about who gets to claim the word clinical and who is restricted to counseling, as if these identities are airtight compartments that never overlap in real life. Now, let us actually clarify how training works at a master's level, because a lot of this debate ignores the structure of established educational programs. A master's degree in psychology is typically 2 years, right? The first year, it focuses on the foundational needs. Many students who enter the domain from non-psychology backgrounds, they use this time period for introduction and consolidation of concepts, theories, statistics, psychopathology, assessment basics, research methods. Even those who come from psychology background use this first year for structured revision. All in all, it levels everyone. It builds common language. It builds conceptual stability before specialization even begins. Now, in the second year, in the same master's program, the specialization happens. Students then get to choose whether they would go for clinical, counseling, industrial, or any other area that is available within the college or the university. If someone chooses clinical, that entire one academic year is dedicated to clinical immersion, supervised cases, hospital postings, exposure to psychiatric units, assessments, therapy sessions, case documentation, multidisciplinary case discussions. Is this a joke? It is structured responsibility under supervision. One full year of immersion in clinical environments. And it is the same thing that happens if one chooses to do PDCP, that is postgraduate diploma in clinical psychology, which is also clinical exposure and all that I just discussed in a year's time. So, if PDCP is valued, why not the second year of master's training in clinical equally valued? This is my major question. Then people would argue that PDCP is more hardcore. Then why isn't the education system in the country not asking for similar number of hours from students who want to call themselves assistant clinical psychologists, just somehow manage those many hours, 2000 hours if that is the need, and then position themselves as credible clinical psychologists? For that, you do not have to go through PDCP pathway. You can still get those many of hours if you just make a rule that in order to be recruited, you need to have so many hours. Do you have these hours? And are these hours logged and recorded in verified hospital settings, in jails, in semi-urban and rural places? So instead of making all these happen through a university funnel or a college funnel, why not just open this funnel and interest more people to participate? Because India is currently in huge crisis to provide for mental health professionals who would take care of India's need in the domain. Who are these people to fulfill if we do not open up the area? Then comes the Masters in Clinical Psychology, which is the replacement for the new MPhil in Clinical Psychology. So this MA in Clinical Psychology, this is another ridiculous pathway. I mean, okay, If I have to do it, I will do it nonetheless because it's a legal requirement. But the whole point of this video is to question this arbitrariness, to question why we have systems that are so counterproductive. 2 years of MA in clinical psychology is not the only way to have that immense exposure to acute psychosis, to severe mood disorders, to crisis intervention, to rehabilitation work, right? Let competency be measurable rather than keeping it symbolic. The same number of hours that a master's in clinical psychology a student would get, which is close to 5,000 to 6,000 hours or whatever, why not keep it open and tell people go get this experience? Because if we keep it to universities and we keep it through these entrance exams, what happens? It's an entire business ecosystem that builds around this. And then, even if a candidate clears the entrance, they have to think of a minimum of 7 to 8 lakhs to get into your university. All private universities are tremendously expensive, and if it is about PsyD, which is equivalent of a PhD of 4 years, right? PsyD in the country only has a handful of seats and it costs you around 16 to 17 lakhs, right? Amity would tell you that. So, do all of these justify? Really, tell me. You clear your entrance and then you have to pay for your admission, and once you pay for the admission, then there will be still many places saying this is not enough experience, we need so and so, and then there will be court cases like this one. And MA in clinical psychology is not enough, then one would want to do a PhD, which is another investment of 5 to 6 years, because again, PsyD is only a few seats and then extremely expensive. Now, one would argue that, oh, then people should try for government colleges. How many government colleges in India are already ready with MA clinical psychology positions? That is number one. Number two, how many seats do they release compared to the need that is there? And if it is government setup, it is then a government hospital. Government hospitals are always busy. Then how can you claim that these government hospitals are gonna put attention on you at par with the attention you get from a private system, where they are obliged, in fact, to give you that focus because they are taking money for it, and that is what they sell. That is their USP, right? Okay, now coming to counseling and clinical divide. Tell me, when a patient walks in to your clinic, do they come into your clinic first by going on to LinkedIn? Oh, there the person identifies as a clinical psychologist. Oh, this person identifies as a counseling psychologist. This is how. No, they will just pour in from any walks of life. They may be super educated, or they may have no education, or they may have not enough education, right? So, all in all, they may not have tremendous insight into these professional divides we have already created within the system. And once they come in through the door, would you not listen to them? Would you not assess them? Without assessment, would you just start with your therapy? And if you have to do therapy, then you have to assess. And if you have to assess, there will be a diagnostic conclusion, right? There will be the basic provisional diagnosis, and then there will be a differential diagnosis, right? Unless you go for a PDCP or an MA clinical psychology, you don't know how to conduct a case history or an MSc. Your college was not enough. And this starts in colleges right from the graduation days, right? And for those who are from non-psychology background, they go through even a rigorous training. Because also imagine, for them, they are new to the domain. And if they are qualifying with flying colors, why question their integrity without knowing their competency in real life? So where do all of these imaginations come from? Like who to stop, who not to stop? See, I have a clear proposition and I want you to share this with as many people in the domain possible. It will benefit the entire system, everyone. I keep on doing videos and I do not see any responses from you guys to the extent my videos deserve, because I do not talk about stuff that are of no relevance to your life. So share this, right? So my proposition is, once Masters in Psychology is completed, from now on, from UGC recognized universities, then keep the the gate open. Ask for 2,000 hours of clinical exposure from varied domains that offer mental health support in the country and very places where those services are offered. Urban, rural, semi-urban, jail setting, school setting, college setting, hospital setting, psychiatric asylum setting, right from any setting. Ask them to get those 2000 hours if they want to identify as assistant clinical psychologist. And if they want to graduate from there on, ask them to get another 2000 or another 3000 hours to go to the level of an independent clinical psychologist. And if someone wants to at once get identified as a clinical psychologist, then they should land with those 4000, 5000 hours of clinical psychology experience or exposure. This does not force a student to undergo unnecessary pressure because that is totally irrelevant. Putting someone through pressure does not have any relevance with their talent. We as psychologists should already know that. And then it will not put these students under the pressure of arranging tremendous amount of money to give to these private universities and really save it to start their own practice, because practice is also very capital intensive. Or if not have one permanent practice unit at a given place, enable them to travel the country and reach out to those people in crisis with mental health. This is how you enable. This is an enabling system. It's not the time for, oh, you can't call yourself a psychologist, or you can't call yourself a clinical psychologist, or you can't call yourself a counseling psychologist. This is such rubbish. This is such a waste of time. This is so unintellectual. This is so unintelligent. This is so unpsychological.